In tonight's health news, the best news, we're talking about ways to look younger. The FDA has just approved a new treatment. It's the first filler approved only to temporarily correct age-related volume loss in the cheek area in adults. We're talking about these. How does it work? What skin types can be treated? And what are some of the most common side effects? We'll answer it all here with Dr. Mitchel Goldman, Dr. G from UCSD. Thank you for being here.
Good to be here.
Tell me, what is this Voluma and what separates it from the rest of these fillers that millions of people get each year?
Yeah, well, about 2 million people get fillers in their face every year, and they could be from anything from the lips to what are called the nasolabial lines. But this is the first filler that actually lasts for over 2 years, and what we use it for is what's called mid-face filling. What ends up happening is that after the age of 40, especially if we're trying to maintain a really nice figure, we lose the fat in our face before we lose it in our butts. And so what ends up happening is our face gets really gone. When your face gets really gone, you get saggy. And so what we found is by reestablishing or filling up the mid-face, we can actually rejuvenate people, give them back their younger appearance.
And what is the filler made of?
It's made of hyaluronic acid, which is a natural substance. It's in all of our bodies, and it's bioengineered. So it doesn't come from any animal sources. Essentially, there are no reactions to it.
And you know this firsthand because you were a part of the clinical studies here in San Diego. And you say this is actually a way to maybe avoid a facelift down the line if you don't like the way that you're looking.
It really is, because so often the reason why we develop sagging skin is because we've lost the volume in our face. If we can restore that youthful volume, we can not have to do things with the knife.
Well, let's look at some of the before and afters and see the results of this. How long does the treatment take? And tell me what I'm looking at here.
You know, what you're looking, especially if you look at this woman, she's fairly attractive to begin with, but she's lost those cheeks. She's lost that volume. And it takes about, literally 5-10 minutes. We could revolumize the cheeks. It's just about painless. It gives you that curve, a more youthful look.
Kind of that apple in the cheek?
Absolutely, and it lasts for about 2 years. Now,
one treatment lasts 2 years?
At least 2 years. I have some patients now, they're going upwards towards 3 years, and they still look phenomenal.
So let's talk about some of the side effects, because this is something that I guess you could do on your lunch hour and go back to work, but there are some things to consider?
Absolutely. Whenever you do any kind of injection, of course there can be a bruise, and that's the #1 side effect. We really don't have any other types of side effects. We don't see a lot of real problems, but there can always be some lumps and bumps. Of course, a needle going into your face is a little bit painful, but really, we found that this treatment is very, very safe and effective, and at least in our clinical trials, we had absolutely no side effects at all.
And what's the cost? What are we talking ballpark here?
I don't even know the cost yet. The company is...
It's that new.
It is. It was just approved by the FDA. The product will be released the first week in December. I don't even know the cost, but usually it's going to be in the $1,000 range, maybe $1,500, to give you a result that's going to last for at least 2 years.
All right, so ask for Voluma.
Voluma.
Voluma is the new catchphrase. Perhaps, Andrew, instead of something else in your stocking, you could literally stuff it with Voluma. What do you think?
Absolutely, and I'll come personally and inject it in.
All right, Dr. G, always great to have you. Thank you.
Good to be here.
All right, Andrew.
What are you saying? What are you saying?
I was talking about myself. I'm the older one here.
All right, thank you, Kathleen and Dr.